We all struggle to make decisions at some point, but sometimes people aren't able to make a specific decision when they need to, because, as the law puts it, they have an impairment or disturbance in the functioning of the mind or brain. Not being able to make this decision is known as lacking capacity. A lack of capacity could be the result of illness, drugs, alcohol, injury, learning disability, or a health condition like Alzheimer's. An impairment can be permanent or temporary, but it doesn't actually matter when making your assessment, because making a capacity assessment means finding out if somebody is able to make a specific decision at the time that that decision needs to be made. So on the same day, you may encounter an elderly patient with dementia that you suspect lacks capacity, and a young person so intoxicated that you're sure that they're not able to make a good decision. Both require exactly the same approach when assessing capacity. It's important to remember that you're not trying to determine someone's general ability to make decisions. And if you think someone temporarily lacks capacity and the decision isn't urgent, then wait and see if they can make a decision another time. In the case of our intoxicated young person, that may mean waiting until they're sober. As you will already know, there's an important 4-part checklist to follow when you're assessing somebody's capacity. Understand. Ensure somebody understands all of the information relevant to that decision. Retain. A person needs to be able to retain the information long enough to make the decision. Weigh. A person should be able to weigh up all of the information when making a decision. Communicate. A person must be able to communicate their decision. If a person is unable to do one of these things, and they've been given all of the appropriate help and support to make the decision, then it may be considered that they lack capacity. To avoid tricky situations, the Mental Capacity Act has 5 statutory principles that everybody should stick to. 3 of these apply when making an assessment. 1. A person must be assumed to have capacity unless proved otherwise. 2. A person is not to be treated as unable to make a decision unless all the practical steps to help them have been taken without success. 3. A person is not to be treated as unable to make a decision merely because they make an unwise decision. I can't stress how important it is to assume that somebody has capacity until proven otherwise, and that every possible effort is made to give them time, help, and support to understand all of the information. We want all our staff to have the confidence to make mental capacity assessments. To see these principles being put into practice, take the time to view the self-neglect and learning disability scenario videos in this series.